Yeah, so for E, vitamin E is more like an antioxidant, just like vitamin C. Um, it kind of protects the nerves and the red cells. So, because of its antioxidant property, it protects the red cell membrane from destruction from by free radicals. So that means that if there's vitamin E deficiency, the red cells in neural membranes will be damaged easily by free radical attack. So that's why people with vitamin E deficiency can experience hemolysis of the red cells. They can also experience a disruption of the red cell membrane structure. So they appear as acanthocytes. And there's also destruction of the dorsal column. So they have problems with vibration and proprioception. So if you see a patient having problems with dorsal column, hemolytic anemia, think about vitamin E deficiency. The vitamin B12 deficiency is going to be very similar, but you will not have hemolytic anemia, but rather there's going to be megaloblastic anemia. So vitamin K is another vitamin you need to supplement infants that are being breastfed. Um, they might not be able to synthesize a lot of vitamin K because they have a sterile gut, so the microbes are not there yet to produce vitamin K. So at delivery, but you might need to give the iron vitamin K, right? So how do you know? In unit I just recently delivered having bleeding, right? You did the coagulation profile, you are able to observe elevation of the prothrombin time and activated partial thromboplastin time. You know, it's in keeping with vitamin K deficiency because vitamin K is important to activate the clotting factors, factor 2, 7, 9, and 10. So if they are not being activated, you are going to have problems with prothrombin time and the APPTT. They are going to be prolonged. But the bleeding time is going to be normal. So that's going to raise our suspicion of vitamin K and nothing else. Because um, the vitamin K issue doesn't affect the platelets, right? This is not DIC. So the platelet is okay. The bleeding time is going to be okay. So it can be a fatal cause of neonatal hemorrhage. So you must give them the supplemental iron vitamin K. Selenium is also another nutrient that can cause some issues, particularly cardiomyopathy. Selenium is selenium deficiency can cause what we call the Keshan disease. So this Keshan is a town in North China that um, selenium deficiency is rampant. So it's been observed that selenium deficiency kind of predispose them to attack by a virulent strain of Coxsackie virus. So that can trigger um, cardiac myonecrosis and cardiomyopathy at the end of the day. So there's weakness of the cardiac muscle. It cannot contract, so it fails, right? And selenium again can also cause problem with thyroid function because selenium is important to convert T4 to T3, right? So don't be surprised seeing somebody with selenium deficiency having hypothyroid features. Keep your mind towards selenium deficiency. They can also have problem with the bone, right? And of course, it's important in normal function of the macrophages. So if the macrophages are compromised, there's going to be high predisposition to infection. So selenium deficiency, cardiomyopathy, bone issues, um, thyroid problems, and infection. Selenium. Zinc is a cofactor for so many enzymes of the body. So many enzymes of the body are dependent on zinc. So it causes um, impairment of so many organ function, the brain, the GIT, the reproductive, the skin, right? So the brain, think about problem with special senses, taste, smell. So they have dysgeusia, they cannot smell, they cannot taste properly. Anosmia, they cannot smell, right? They can have hair loss. The zinc is important to produce testosterone, so they can have hypogonadism, low libido. They have poor distribution of the pubic hair, axillary hair is not there. Impaired wound healing, immunosuppression, right? And in congenital cases, you can have what we call acrodermatitis enteropathica because it's just more like a congenital problem of absorption of zinc in which the baby is going to come down with a triad of, you know, from the word acrodermatitis enteropathica. So acro dermatitis. They are going to have dermatitis, hyperpigmentation of the skin, particularly around perioral areas like area around the mouth, as well as within the fingertips and the toes. So they have acro, fingers and the toes, dermatitis around that area, enteropathica diarrhea, enteropathica diarrhea. With these two, you are going to see hair loss. So hair loss, dermatitis within the fingers, the toes, and diarrhea is in keeping with zinc deficiency. So let us quickly look at conditions I share with some neoplasm. So the first we have here is acanthosis nigricans, which is more like hyperpigmentation and from epidermal thickening of um, intratriginous areas of the body like the groin, or particularly the armpit, right? The armpit rather, the armpit. So when you see these darkish, velvety-like lesions, thickenings within the armpit, that is acanthosis nigricans. It's very common in people that are obese and people that have some particular um, malignancy. So it's being related to hyperactivity of insulin as well as paraneoplastic features of some malignancy. So think about visceral malignancy, particularly stomach cancer. Once you see acanthosis nigricans, it can come from lung cancer, breast, uterus, but it's not as common as that of stomach. Stomach is number one. Actinic keratosis, when you have like erythematous scaly lesions within sun exposed area, they are high risk. They are high risk for squamous cell carcinoma of the skin. Very, very important stuff you cannot forget for the dermatology. Eight, people with hate, because of the chronic inflammatory process that happens in hate and because of the background immunosuppression, there's a high chance of them having some immunodeficiency, some malignancies, right? Common cancers they have Kaposi sarcoma, human herpes virus type 8, the Kaposi sarcoma virus, in which they are going to have some volaceous, papules and nodules within their body. It can affect the oral cavity, it can affect the skin, it can affect the GIT, it can affect the lung. Remember, they can be predisposed to having cervical cancer. Immunosuppression is a very high risk for developing cervical cancer, right? Because of the high chance of them getting infected with the HPV virus. And the HPV virus has a very free medium to operate and lead to, cancer. Then also malignant non-Hodgkin lymphomas. So think about those non-Hodgkin lymphomas, the follicular carcinoma, you know, the diffuse cell lymphoma, but commonly the primary CNS lymphoma. The primary CNS lymphoma. Most of lymphomas are malignant tumors, so we don't even need to be saying malignant, blah blah. Lymphomas are malignant tumors. So it's just that some are indolent, some are highly aggressive. So primary CNS lymphoma very common in hate, Kaposi sarcoma, cervical cancer, very common in people that have HIV. Autoimmune diseases like myasthenia gravis, think about thymomas, just like um, the Lambert-Eaton condition. You have to think about small cell carcinoma, right? Barrett esophagus, because of chronic reflux of acid from the stomach into the esophagus, kind of lead to a metaplasia of the squamous epithelium of the esophagus being changed to the columna of the stomach. So that's a very, very important precursor lesion that can easily progress to esophageal adenocarcinoma. So you tend to start having glandular differentiation kind of in the esophageal mucosa, and from there they can develop into adenocarcinoma because the stomach is filled with glands, right? So that means that it's going to change the esophagus to a cancer that's producing gland. That is it. So chronic atrophic gastritis, pernicious anemia, post-surgical gastric remnant, they are all risk factors for developing gastric adenocarcinoma. So, chronic inflammation from our pathology can progress to developing malignancy, right? Pernicious anemia, because of the chronic atrophic gastritis that can happen from here too, and retention of gastric remnants after surgery, they can all irritate the stomach and they can lead to gastric adenocarcinoma. So people that have liver cirrhosis from any cause, either from alcohol, from hepatitis B, hepatitis C, Wilson disease, hemochromatosis, they can all develop hepatocellular carcinoma. Alpha-1 antitrypsin deficiency is a lot. Down syndrome, two major cancers: acute lymphoblastic leukemia in people that are young, and acute myeloid leukemia in people that are old. Immunodeficiency state, we have talked about this, the lymphomas, Burkitt lymphoma, primary CNS lymphoma, you know, is very common. Even Hodgkin lymphomas too, in people that have immunodeficiencies. The dysplastic nevus. So we talk about this in our dermatology proper. They can help predispose to developing melanoma. So you see somebody that's having more like something that look like a mole, like a nevus. Melanoma is the most likely cancer that can develop from that. Neurofibromatosis type 1. We already know this in our neurologic section. They can develop pheochromocytomas. They can have neurofibromas of any part. They can have optic glioma of the face, of the optic nerve. So NF2, neurofibromatosis type 2, think about acoustic schwannomas, right? Acoustic, vestibular schwannomas. So they start having auditory problems. Paget disease of the bone, very common for osteosarcoma. Secondary osteosarcoma, very, very common. They can also have fibrosarcoma. Plummer-Vinson syndrome, we have talked about this in our GIT section. Iron deficiency anemia causing esophageal work with dysphagia, right? They, can irritate the esophageal lining, causing squamous cell carcinoma. Tuberous sclerosis is actually with facial angiofibroma, seizures, intellectual disability. They are all associated with astrocytoma of the brain, as well as cardiac rhabdomyoma. So, a patient that's having tuberous sclerosis, think about cardiac rhabdomyoma or astrocytoma. They can ask this in our exam. Very important stuff. Ulcerative colitis is it's a very high risk precursor lesion to colonic adenocarcinoma. Xeroderma pigmentosum too, can cause squamous cell as well as basal cell carcinoma of the skin. So this is very, very important. So we have to take note of that.